Globally, only half, that is 52%, of children living with HIV have access to life-saving medicine. In sub-Saharan Africa, adolescent girls and young women are 3 times more likely to acquire HIV than adolescent boys and young men. Hello and welcome to another episode of The Last Mile with NACA. I am Adesuwa Osui. Despite advances in the prevention and treatment of HIV, there are certain vulnerable groups and key populations that remain disproportionately affected by the disease. Inequality has been identified as a major driver of the epidemic.
Scientific strides in HIV treatment and prevention have reduced transmissions and HIV-related deaths significantly. However, inequality threatens efforts to eradicate the disease as it disproportionately impacts marginalized groups.
We say inequality, and generally we are referring to two things, either prevention or treatment services. And we are talking about access to the services. We've made conscientious efforts over the last decade or 2 decades to make HIV prevention and treatment services available all over the country. However, in terms of access, there are certain population groups that are more vulnerable, and that because of stigma and discrimination and because of economic barriers or because of social and societal and cultural barriers, they find it very difficult to access the services, even when the services are by their doorstep.
Globally, AIDS-related death has reduced of about 52%. So this is quite a good news. New HIV infections have declined by about 32%. This is not good news. So when you are looking at what will it take, to end AIDS, it is obvious that if we do not, end the inequality, economic inequality, legal inequalities, social and cultural inequalities, it will be difficult.
Young women and adolescent girls in particular account for a disproportionate number of new HIV infections.
We see the gap on the vulnerability between the boys and the girl of the same age. Prevalence, sometimes it's even 3 times higher on the young girls as compared, to the boys of the same age brackets, because they are vulnerable. They are vulnerable because the knowledge is not there. They are sometimes coerced, to have sex with older men, in different situations. In Nigeria and elsewhere, you've got early marriage, which also are parts of the entire spectrum of what you call gender-based violence. Gender-based violence, there's a link between gender-based violence on HIV acquisition. Keeping girls in school, evidence is showing that when you keep a girl in school to complete, the secondary education, it reduces her chances of about 50% of acquiring HIV infection. So if you add comprehensive sexuality education, if you add her sexual reproductive health and rights, she will be further, protected. But because of some culture and tradition in many places in the world, there will be a tendency to favor, the education of the boy, child versus the girl. That's also inequality.
In 2019, Nigeria alone accounted for approximately 15% of vertically infected children living with HIV born globally.
We've made progress in putting people on treatment, but it's just not acceptable, so that less than 40% of the children living with HIV and AIDS in this country are on treatment. It's not acceptable. We need to make sure, so that we identify those children living with HIV and AIDS and we put them on treatment. We've made progress in reducing new infections, but it's just not acceptable also that about 5.5 million women who get pregnant every year in this country, out of 8 million, still do not have access to services where they can be tested, and if found positive, so they can take the medication to reduce mother-to-child transmission. We need to do more in such a way that programs, comprehensive programs for adolescent girls and young women, key population, so can be made available in the entire nation.
To address economic inequality, which are both drivers of the HIV epidemic, NACA, with support from partners, have carried out several empowerment programs for vulnerable populations.
Where people lack money to transport themselves to places where services are being provided, we make an attempt to empower people, to teach people how to do small or to create small business at the comfort of their house, and then give them some seed money to initiate and make that business work. That is expected to take care of the small transportation money they will require to either go and receive treatment or to go where services are provided and access our prevention services. We also provide self-test kits for vulnerable groups and population at high risk to test themselves at the comfort of the room, and also to share the test kits with their contacts or their loved ones. That will also help for somebody that tests HIV positive. If he gives or she gives the test kits to his or her contacts, it's likely if they are also infected, they will also test HIV positive. What that will do is tracing contacts of people who have the virus will help us find additional people who are infected or affected by the virus.
In the context of the situation of Nigeria, I think we really need to recognize the remarkable progress that government at the federal level and then at the state level, with the support of partners, the UN, Global Fund, PEPFAR, and others, have made in the AIDS response. In Nigeria, it is estimated that about 1.9 adults and children are living with HIV and AIDS. If we look at the 2021 data, about 1.8 million were on treatment. This is on life-saving treatment. So this is remarkable. This is commendable. New infections have declined, not at the speed we want. Government continues, so to make efforts in ensuring that a government can provide resources in such a way that antiretroviral drugs can be procured to put about 50,000 people living with HIV and AIDS every year on treatment. This is laudable. An HIV trust fund, so was also established, so it's a public-private partnership to make sure that we can have more resources to address mother-to-child transmission and then pediatric AIDS. We are also in a situation where in an area of human rights, there's a memorandum of understanding that has been signed between NACA and the National Human Rights Commission. So again, those are really good progress, and the government has to be commended, for that. But in the context of World AIDS Day, in addressing those inequality, I really think we can and we should do more. Nigeria, it's a resourceful country.
The National Call Center for HIV and related diseases, domiciled in NACA, plays a critical role in addressing inequalities.
We also provide services from our office here. We call it National Call Center. This is for people who lack access to services, people who want to ask questions about where these services are located, to call from wherever they are in the country. We should be able to provide them a facility or location nearest to them where they can access our services. This is one. And if they are stigmatized or discriminated against, we should be able to link them up with National Human Rights Commission that will help to fight for their rights, because there is a law against stigmatization and discrimination. And individual can be fined or can be jailed or can have both, depending on the gravity and depending on what the court decides. But this is in addition to treatment services that are all over the country, prevention services, where individual can walk in and demand for HIV testing, or walk in and demand for HIV treatment if they are found to be HIV positive.
Inequality is structural when policies keep some groups of people from obtaining the resources to better their lives.
If we have in place the laws and then the policies that, so will criminalize men having sex with men, female sex workers, people who inject drugs, don't get me wrong. I'm not saying that we should encourage that. That's not what I'm saying. I'm saying, so they have the right, so to health, regardless of the religion, regardless of the sexual orientation. So if we have in place the laws and then the policies that will make those key population go, on the ground, it will fuel, so the epidemics. If you have in place the laws and then the policies that will continue to favor user fees, that's also an economic inequality where those who will not be able to pay will not be able to have access to the services. If we have in place laws and policies that will prevent, so the community of people with HIV and AIDS, young men, so young women, to develop and implement, so in their community, programs that will prevent them from acquiring HIV and AIDS, that's also an inequality.
Ending AIDS by ending inequalities also means more participation from state governments through sustainable HIV financing.
More than 90% of the AIDS-related activities, especially the procurement of antiretroviral drugs and then the commodity, are funded by PEPFAR and Global Fund. Let's make no mistake, so that generosity will not continue at eternum. And we need to begin to think along the lines of how do we increase domestic resources to make sure that gradually, so Nigeria can sustain, can be self-reliant, so to fund, so its response. A couple of years ago, we agreed on the Abuja Declaration, where each country should be putting about 15% of its budget, so into health. We're not there yet in Nigeria. We're a little bit less than 5%. So how do we make sure that we increase more resources in the budget, so to ensuring that health is funded? There's a provision that in each state, 1 to 5% of the resources, so allocated should fund AIDS responses. So why is that not happening? So we need to understand, that we're doing it primarily for, so those who have elected us and put us in power.
It takes a lot of advocacy and it takes a lot of discussion and negotiation for government to set aside resources and to continue to increase in terms of resources that is given. We have had an agreement and we're fulfilling our pledge of making sure we increase our investment in terms of spending on HIV, and we sensitize states also to do so. Some states are already doing, others are coming on board. We are hopeful in the next 2 to 3 years, we will get virtually every state in Nigeria on board in terms of looking at HIV as something that they in their own state they can manage. They, in their own state, they can look after, just like they look after tuberculosis in their states, they look after malaria in their state. They should be able to be empowered also to look at after HIV in their individual states.
Recognizing the equal worth and dignity of every person is an ethical imperative. Ending inequality is the path to equitable access to services for people living with HIV and to a healthier world for us all.
On equal access to HIV prevention and treatment services, perpetuate HIV among vulnerable population groups. This year's World AIDS Day seeks to equalize access across populations that are marginalized among vulnerable and key affected population groups by removing economic, social, cultural, and legal barriers to HIV prevention services across population groups that are vulnerable to HIV. Globally, we call for equalize. Locally, we say equalize to end AIDS.
End Inequality and AIDS. Update segment is next. Keep watching.
The National Agency for the Control of AIDS, NACA, recently organized a press conference in Abuja as part of activities to commemorate the 2022 World AIDS Day. The Director General, NACA, Dr. Gambo Aliyu, delivered the opening remarks.
This year's global theme for the World AIDS Day is to equalize. And our national theme is Equalize to End AIDS. As we commence the process of marking the 2022 World AIDS Day, let me re-emphasize that on equal access to HIV prevention and treatment services perpetuate HIV among vulnerable population groups. This year's World AIDS Day seeks to promote equal access across population groups that are marginalized and vulnerable, key affected population groups, by removing economic, social, cultural, legal barriers to HIV prevention services as well as treatment across this group. The focus will now be directed of ensuring increased availability, equality, and sustainability of services for HIV treatment, testing, and prevention for hard-to-reach population, especially communities circumscribed by conflict.
Speaking further, the NACA DG highlighted some milestones in Nigeria's HIV response.
Nigeria's success story is evident from the significant reduction in HIV prevalence. As at the end of September 2022, we have about 1.6 million persons living with HIV/AIDS on treatment, which represent a significant increase when compared to just a little over 800,000 in 2017. New HIV infection gradually declines from 103,000 in 2019 to now just a little over 92,000 in 2021. Through our Alignment 2.0, HIV prevention and treatment is shifting in terms of its ownership to states. The launch of 62 billion HIV Trust Fund earlier this year by His Excellency President Muhammadu Buhari is geared to supporting this ownership and ensuring that states are taking the center stage, as well as closing the gaps, especially in our programs, and more especially in prevention of mother-to-child transmission of HIV.
Dr. Aliyu then called for more active participation by the states if the response is to be sustained. Goodwill Messages were delivered by representatives of the Federal Ministry of Health, United Nations, implementing partners, and other relevant stakeholders.
We're here to show our support, our commitment to working very closely with government, other partners, and the communities to see how we can end AIDS in Nigeria by 2030. Equalizing in the context of Nigeria and in many other countries will mean we do everything possible to reduce our dependency on external resources to fund our program. Very simply, it will mean, so that we take away users' fees, which are still an impediment to access to services. It means we should increase our contribution, to funding health. Equalizing while acknowledging the role of the government also means we should put the community at the center of our response. I will end by pledging, by committing UN support, the entire UN system in Nigeria, in working very closely with the government, with the partners and the community to making sure that we can end AIDS in this beautiful country by 2030.
The theme is clearly a call for action, a call for a renewed commitment to achieve epidemic control and further actions towards ending AIDS by 2030. In Nigeria, we're moving closer and closer to our targets. We're certainly proud of the achievements we have made, working together with our partners. Having come this far, we must all now work together to address the inequalities which pose a barrier to ending the epidemic. We need to equalize access to essential HIV services, particularly for children, pregnant women, key population and their partners, and those in closed settings who are often forgotten. The Federal Ministry of Health through NACA affirms its commitment to continue to push for programs and policies aimed at addressing inequalities in access, to access also to high-quality HIV testing and treatment services. I also want to urge all our stakeholders, including the press and other partners, the communities, to remain steadfast and join the drive to tackle stigma and discrimination and other structural barriers that affect access. Let's all work together to equalize.
World AIDS Day is marked on December 1 every year since 1988. It is to raise awareness on the AIDS pandemic caused by the spread of HIV infection and to mourn those who have died of the disease.
Every year on the 1st of December, we mark World AIDS Day. This year, the global theme is Equalized, but we have domesticated the theme, which is Equalized to end AIDS, equal access to prevention and treatment services. We have so many activities, inclusive of HIV testing services, roadshows, adolescents and young people activities, technical sessions looking to address issues around gender and rights, testing and treatment uptake. We also will be looking at issues that have to do with accessible testing and optimized treatments and comprehensive care for infants living with and exposed to HIV/AIDS. And finally, we have a major event on the day of the World AIDS Day itself on the 1st. And then we will be having launch of strategic documents, and we'll have key partners also giving messages, speaking to the team. We believe if we equalize, we'll be able to take care of issues around inequalities among the marginalized and key population and end this before the year 2030.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as we draw closer to the 2022 World AIDS Day celebration on December 1st, let us equalize to end AIDS. Do not stigmatize or discriminate people living with HIV. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesuwa Osui. Goodbye.